Welcome to the Healthy Careers Podcast, where we help healthcare providers succeed on purpose. We take a conversational approach in learning from others who have been there and done that. Join us as we share expert insights from real people who are just like you, because we believe that success isn't just a destination. It's an intentional journey, and you don't have to do it alone.
All right, welcome back to the Healthy Careers Podcast. I'm your host, Maddie, and today I'm excited to have Dr. Cohen with me. He is somebody that is from Rhode Island, not New York, okay? Everybody, when I tell them I'm from Rhode Island, they're like, I love New York. Not the same thing. We're not from Long Island. But he has worked as an orthopedic surgeon for 6 or 7 years, I think, or 6 years, you said. And today we're going to talk about a few different things, from work-life balance to also how orthopedics has changed over the last decade or so when it comes to what I really see as patient care and quality in patient care for people that are going through major surgery. So today we're going to talk about all those things, and I'm super excited to have Eric on the podcast.
Yeah, Maddie, thank you for having me. I'm super pumped to be here and talk about these subjects that I'm passionate about. So thank you.
Of course. Yeah. So first and foremost, tell us a little bit about just you in general. What inspired you to become an orthopedic surgeon?
Yeah, so growing up, my father was in the Army, so we moved around a lot. We ended up going to Landstuhl, Germany, which is a big regional medical center for all of Europe. So I lived there for 6 years, 7 years, and basically all is there is the hospital. So, you were really exposed early to medical, dental care. That's where everyone came. And so that was kind of like my early exposure. Always had an interest in orthopedics growing up because of sports and sports injuries. And it was kind of this natural transition. So when I went to med school, I kind of knew I wanted to do orthopedics. What I tell every med student is even if you think you want to do something, do everything and do it well and learn as much as you can about every subject, because all of it, interplays together. And if you're a good medical doctor, you'll be a good surgeon and vice versa. And you kind of figure that out. I knew I wanted to do surgery, and I just naturally gravitated toward orthopedics during medical school.
That's interesting. And did you find, because I feel like I heard this a lot, my parents are teachers. And as you know, in the state of Rhode Island, like, you're either a teacher or a doctor or like a nurse. There's no other professions unless you want to go to Boston or New York City. So for me, I knew I was leaving Rhode Island, but my parents stayed there and they taught for, I think, almost 35 years. And wow. They could have kids in 8th grade and say, like, that kid's going to be a doctor, that kid's going to be an engineer. And most of the time they're right. And I found that it was like a natural aptitude towards certain subjects. Did you find when you were going through just grade school that you had a natural aptitude for science or math or one thing or the other?
Yeah, that's interesting. I was very science oriented, growing up, and I went definitely the traditional path, from science in high school to science in college, a biology major, and then, straight to medical school. Certainly there's lots of alternative paths, and, you could be a humanities major, and in fact, it's encouraged in a lot of ways to go into medicine. But yeah, I definitely had like that more science math brain where, if you, like, my wife is English all the way, and, she could write anything and read anything. She's super talented at that. I kind of have the other side of the brain with the math and science.
Yeah, I think that's also interesting when you look at that from just a perspective of what people land in. I think what is it? Math is left brain dominant, and that's right there along with, like, I think music, which makes absolutely no sense because I play 3 instruments and sing, but I'm the worst person at math. Like, I can't even do simple equations unless it's money oriented. But yeah, I mean, I think there's that natural kind of person that always knows they want to get into science. And that's traditionally the route that they take. Where did you go to undergrad?
Yeah, so we moved to Tennessee when I was in high school. So my junior year of high school, I moved to Tennessee. I don't have a Tennessee accent because I moved there when I was in high school. So yeah. I think that was already developed. But went to undergrad at University of Tennessee, Chattanooga. So and not too far from where you are in Atlanta. And then went to medical school in Memphis at the University of Tennessee. Wow. So then I came up here for residency. I matched here for orthopedic surgery residency at Brown. Ultimately met my wife, who's a Rhode Islander, and I've been in Rhode Island ever since.
Oh, now I got to figure out who your wife is. Maybe I know her because you're not from Rhode Island, but you know how that goes.
Exactly. Once you once you're in Rhode Island or marry Rhode Island, or you stay. So I'll be here. I'll be here forever. But I absolutely love it. I will tell you, it's a best kept secret in the U.S. Maybe I shouldn't say this on this podcast because everyone's going to move here. But I've lived a lot of different places, South, Midwest. I guess I haven't lived in California, but I've been in California. I think Rhode Island's a real gem, just with the people who are super kind, the access to the beaches, the access to the mountains. We have a great city in Providence where there's just a lot to do. So I'm definitely feel like I'm Mr. Rhode Island, and I try to sell it to everyone who comes to train here, and to train with me here. So.
Did you tell them about the blue bug on the highway?
Oh yeah, oh yeah. And then, you can reference Dumb and Dumber. There's something about Mary, but that might show my age
Yeah,
to some of the 20 somethings that are coming to learn here at
I know.
residency.
It's so funny. People will be like, "Isn't that where DJ Pauly D is from?" I'm like, "Heck yeah, it is." They're like,
Yep.
"Is that what the
Yeah.
guys are like up there?" I'm like, "Kinda. Some of them, not all of them."
So yeah,
But
it's a great state, and we have people come, train with us for
yeah,
fellowship for hip and knee replacement, and it's funny, like even some of the guys and gals from the Midwest or wherever, they all end up loving it here, and some want to stay. Most have to go where their significant other is from or where family's from, so they end up going back, but a lot of them want to stay.
yeah, that's awesome though. That's good to hear because I know for a while Rhode Island was struggling to keep people in state, and I think hopefully just the cost of homes will eventually even out a little bit, so that it makes it easier for folks, especially those in medical school. But yeah, I think you're so right. You've landed in a great spot, and where you work too has a great reputation and network. So that's awesome. And what made you choose University Orthopedics over all the other options that you could have had? And also, Brown, you've got to be super smart to get in there. So I'm sure you had tons of options.
Yeah, so it ended up being a great transition year from training to stay here. My mentor, who I trained under for the past like 6 years when I was in training, was retiring. Rick Limbard, who is really was a cornerstone of joint replacement in Rhode Island. I mean, you ask someone where you had their joint done, and they'd say Rick Limbard. So I took
Yeah.
over his practice, which was just an amazing opportunity for me and an incredible honor. And so having trained here and then taking over his practice and kind of transitioning to seeing his patients with him to transitioning that care. It's just, it made it an easy decision for me. And the support of everyone here has also kept me here. So
That's awesome. That's good to hear because not every practice is like that. Not every group is like that by any means. So,
no, yeah, it's tough. It's tough to find that. I feel fortunate and lucky. The statistics I think in orthopedics is that 50% of orthopedic surgeons change practices within 2 to 3 years.
mhm.
So their first, wherever they start working first, is not where they end up, staying and
Yeah.
ultimately like they're having their career. Because it's very difficult to evaluate a practice and determine, what you need, and what's out there as far as opportunities just by, going to see the place a couple times. It is a difficult.
It is, yeah. And I feel like, and we can kind of use this to pivot into how orthopedics has changed. I think so much in recent years, especially with just like reimbursement rates and, insurance and everything else, just kind of honestly screwing over some of the things that focus on the quality of care and patient outcomes. And a lot of times, it's like you've got to do more to get more. And so, of course, when you're focused on volume in an outpatient orthopedic setting, you do have to lack on certain things that maybe, if you didn't have that push to bill X amount, then it wouldn't be that way. But, I would love to kind of talk about how you've seen orthopedics in your, from when you started medical school to now, just completely change in terms of, as you mentioned, used to be you go to the hospital for days. Now you're home the same day.
Yeah, I mean, the orthopedic landscape, the medical landscape is constantly changing and has changed tremendously in the past 5 years and even 10 years. When I went through training, it was everyone had a hip and knee replacement in the hospital. They
Mm-hmm.
stayed 3 days. A lot of patients in Rhode Island went to nursing homes or recovery, rehabs.
Yep.
They were put on, blood thinners like Coumadin. And now, patients are leaving the same day, either at a hospital or at a surgery center, having the exact, similar procedure with rapid recovery protocols to keep people's pain down and get their mobility quicker. And that has just been a game changer, not only for orthopedics and medicine, but for the patient. I think the patients are happier. We've seen that there's no place like home, and it's been also allowed us to kind of focus care for each individual patient, which I think is unique, is not everyone's kind of cookie cutter. So focusing on what they need, to get home successfully is also important. So a lot of more planning, I think, preoperatively. So all of this together has led to this rapid shift in the landscape from hospital-based, staying in the hospital several days, to going home. And I think COVID also, helped accelerate that too.
Yeah, and what do you attribute that to? I mean, you kind of saw it slowly over time transition to more of that. So what do you think is the reasoning behind that? Was it just the advancement and the innovation behind how you're doing the surgeries, or how did
I
they
think
be able to cut that time in so many different ways?
Yeah, I think it's a good question. I think it's multifactorial. There's a lot of different powers at play. I think one is the idea that you can do it and see other people do it. The mindset of the patient. If you say I'm going to go home, you're going to go home. If you say I'm going to stay 3 days in the hospital and go to rehab, and you have that in your mind, that's how you're going to recover. So knowing that other people have done that, and then setting that expectation and giving that education, I think was like one key thing, is like patient education. The other part of it was, some of the anesthesia protocols and pain control protocols. The third arm to that, I think, is COVID and not wanting to be in a hospital, or not even being able to get a surgery in a hospital
Yeah,
because
elective surgeries were not
they
a
were
thing.
full. There
Yeah,
was no elective surgery. And then, the fourth is probably, the elephant in the room, the insurers, right? It's definitely beneficial for insurance companies, for Medicare, to have decreased lengths of stays. But obviously, it's also important to have quality outcomes, good outcomes. So it saves them money, and the patients are happy. So I think it's a win-win, for everybody as far as that goes.
100%. Kind of a one-off to that, and this is super random and off topic, but my father-in-law was in the hospital he had a heart attack. He's fine. But they did the catheter, and he was good. But they served him, I kid you not, I was so angry. They served him bacon and eggs and like grits the next morning for breakfast. And I looked at the menu and I looked at it and I was like, don't you think that they would have patients in and out quicker if they gave them food that was catered to like what they're going through? If somebody is dealing with a heart attack, my guess is that you would give them super fibrous food, more of like a plant-based type of diet for faster recovery, and then they're not there as long. But if you give them bacon after they just had a heart attack, and in my head I'm thinking, I can't be the only one that thinks this as far as just how long you would stay in the hospital. And I know that's totally unrelated, but I just found that funny about healthcare.
Yeah, I mean, no, but I think you bring up another idea about nutrition, and that's
Yeah.
very important too. Light meals, healthy meals after a procedure or surgery. Definitely, if you eat a huge thing of bacon or a huge turkey sandwich, you're not going to feel like getting up. And so I think tailoring, the nutritional goals is also important, and we pay attention to that. So actually set up like post-op meals that should fit everyone's diet, and something light for them to have on their stomach to get them moving before that. But the bacon sounds pretty good. That might be a southern thing. We don't have that much bacon in
Don't
Rhode
want to
Island.
go against bacon by any
Yeah,
means, but I think for, within the cardiology unit, there maybe which should be some other options. I don't know. Maybe like turkey bacon, if anything.
sure. That's
A
fair.
little
That's
lower
fair.
fat content.
Yeah, that's fair. I like that.
Awesome. Okay. I guess what else have you seen change? Do you feel like, I know you mentioned, there's no place like home, but do you feel like patients are generally happier when they're able to have that faster recovery?
Yeah, I mean, everyone wants to get back to what they're doing. In a lot of ways, that's the American way. We want to recover quick. We want things fast. And so being home, I think, accelerates the recovery. I think you're more comfortable. You're able to get better sleep
Yeah.
than sleeping in a hospital. And so, that's kind of, I think where that comes from, is no place like home.
100%. And I think too, there's some people, I'm sure that this is an outlier, but I think about a situation where you might have someone who broke a hip because of, they were drinking too much, or, they broke this because whatever it might be, and they're in the hospital. And it's sometimes I feel like it might be better for them to be under care, because the second that they go home, that they're not doing PT. They're just going back to their antics. You know what I mean? But someone that truly has the mindset of like, I'm going to take this into my own hands. I'm going to be responsible for my recovery. I'm sure that there's tons of data around how that, positively impacts being able to go home rather than sit in a hospital bed. Like myself, I would go crazy, absolutely crazy.
Yeah, I mean, you're right. There's a place for everyone, and everyone
Yeah.
has unique needs, and so not everyone is a good candidate, or some people need an extra safety net to prevent them from having problems for whether it's medical or social reasons, and
Mm-hmm.
that's why our hospital systems are so important, and our healthcare systems are important for that, not just orthopedically, but primary care, behavioral, medicine, are all needed, multidisciplinary for these patients.
Definitely, definitely. And tell me a little bit more, I guess, because you are within, you're working with residents, you're working with folks you're teaching, and that adds a whole different element, I think, to your job outside of just being a surgeon. So I'd love to hear a little bit about that, what inspired you to do that, and why you continue to do it.
Yeah, I think it's great. It keeps the job interesting, but it's incredibly important for the next round of orthopedic surgeons to be well trained. They may take care of me, or they may take care of my mom or dad,
Mm-hmm.
and making sure they have the proper training. Is incredibly important. It also, I think, makes, in a lot of selfish way, makes me better, makes me smarter, makes me up to date on all the most up to date treatments, because we're just constantly discussing new articles that come out. We're constantly looking at, are there better ways to do this? Inquisitive minds, is probably most important, and that's being around super smart, inquisitive minds. I think makes everyone smarter. And so, there's the benefit of, if I can train someone and they can go help more people, they can help even more people than I can, as this kind of spreads and they train people.
Yeah.
Yeah, so there's that, and then there's that. I think to be on the top of your game, be the best surgeon that you can be. I think surrounding yourself by the brightest minds is important too, and we definitely have that here at Brown, and so they constantly challenge me, and I challenge them, and it's a great way to be.
Definitely. No, Brown has an awesome reputation. I went to URI, so they wouldn't have let me into Brown, but it's okay. That's why you're a doctor and I'm not.
Rhody Rams, I love URI. My son was just at their soccer camp, and we like to go to their basketball games, so we're
Yes.
big Rhody Ram fans.
Yeah, I know. It was so funny. So I used to work in their alumni association asking for donations. And I got so many people when I'd say, I'm calling from the University of Rhode Island, the alumni association, would you like to donate to like the pharmacy program or whatever? And they'd be like, URI, do you mean you are high? And I was like, no, but do you want to donate still?
I haven't heard that one, but
Yeah, it was way back, but I think that's awesome what you were saying about the teaching. And I think there's two quotes that I always try to keep close to me, and that is, if you're the smartest person in the room, you're in the wrong room, right? It
agree.
might make your ego feel good when you feel like, oh wow, like, I could debate all these people and win because I know more than them. But then you're completely stuck by just what you know, and you're not learning anything new. And I think a lot of surgeons and doctors, or anybody for that matter, right? Like I try to remind myself, just as a business owner, as a recruiter, that, hey, like you don't know everything. And there are new recruiters that are coming out with smarter, better ways to do things that you're sitting there taking way longer to do less efficiently. So just because they have less experience than you does not mean that they're not as smart or they're not as capable. And I think that's a good point, that you don't know unless you surround yourself with other like-minded, inquisitive folks. And the best way to do that is just to immerse yourself in a culture that actually values those things, rather than just the ego of it all, or feeling like, okay, I'm a surgeon, I've made it, now I can just do my job and never have to learn anything new.
Yeah, which is easy to do, but we're always learning and things are always changing. It's just like we were talking about before, how much things have changed since I went through training. So some of the stuff that I learned and did in training, I don't do anymore because it's not actually not the best patient care. So I think we're in an era of incredible change and innovation, not only just obviously in tech, but healthcare as well. And those that aren't paying attention will be kind of left on the back burner here.
Exactly. Nope, I'm with you there. And I think you can either fight against it or you can just learn and soak up as much as you can. And then you have the power to decide if you think that's effective or not.
That's
But
right.
at least you can be informed and have that power and that ability to know, like, okay, if I'm forced with these two options, here's what I'm doing. Awesome. Okay. And then I think another thing that I would love to hear from you that a lot of people struggle with in medicine in general, because I think, like you mentioned, medical landscape is constantly changing, and a lot of people are forced to think that my purpose in life and my whole identity is just my job. Like, I am a surgeon, I am, a doctor, I am a PA, I am a this. And then anything that's outside of that realm somehow makes them distracted from what they're doing. Yet I think it's so important to have hobbies and things that you do outside of work so that you have that balance and you're not just 100% cerebral 24/7. So I'd love to hear your take on how you've been able to do that and just kind of your philosophy around all of that.
Yeah, I mean, I think you're right, and I'm certainly no expert and not perfect at this and trying to figure it out myself. I think, the first 5 years, 4 or 5 years of practice was, it's an incredible learning curve. You're trying to build, your practice. You want to take great care of patients. You're passing the boards, and time can really fly by. So I think the first 3 or 4 years really flew by, and what kind of one of the things that kind of made me wake up and well, there's a couple of things that happened that kind of made me wake up and reprioritize some things was, those memories pop up on your iPhone that show like, 2 years ago, whatever. And, I'll see my pictures of my son when he was 2 and now he's 4 and now he's actually 6. And it's like, man, that seems like that was so long ago. Actually, it wasn't long ago. I feel like I've, missed a lot of that, and you don't
Yeah.
want to miss those type of things. And so, I think trying to find that work-life balance is very difficult, but setting
Mhm.
aside time, whether it's the end of the day or setting off, going on vacations and be able to turn off and spend time with your families, incredibly important because those are the people that are there to support you. Those are the people that are always going to be there no matter what happens. The accolades, the achievements, the, brown med or whatever, those will go away when you retire, but your family is always there. And so, I think it's important to kind of remember that and put that in focus too. And so, that was one of the things that kind of have like pushed the work-life balance to try to find more balance. And again, I am not perfect at this. I'm probably far from it. And if you ask most people, I probably work too much. But the other things were you have one of my colleagues passed away during COVID, from COVID. Like he was my age. He was my, he was my colleague. He was my medical student best friend, and so that puts things in perspective too. And so life is short, and I think finding that balance with your friends and family and not regretting any day is important. And keeping those relationships, with your high school friends, your college friends,
Mhm.
your work friends and also your family friends, like trying to keep that in touch because you never know like when's the last time you're going to get to talk to someone or spend time with them. And so making the most of those situations, I think is important too. And so that was one of the other things that kind of like, it was a wake up call. And then, not taking care of my own health. I think that's also like the other thing that physicians don't do is they don't take care of themselves. And so having a health scare or something will kind of make you wake up, but you don't want to have a health scare and it be too late. So, taking the time to go see a doctor yourself, I think is important, not
Yep.
just for physicians, but really, everybody. I can't tell you how many people I see in their 40s or 50s who have an orthopedic problem. They have uncontrolled hypertension or high blood pressure or something, and they, really haven't never seen a doctor before. It's just incredibly dangerous to be walking around like that. And I think all of us are stressed and kind of get caught in the grind and we don't take care of ourselves. So all those things together in the past couple of years, like past 2 years, has made things kind of shift for me to try to make some more time, take some more days off, and really focus, not look at the rear view, but look forward and say, how can we do this better, moving forward.
100%. And if I got the timing right, you had a kid right when you started working, correct?
I did, yeah. So that was my first child. I have 3 kids now,
Okay.
so it's chaos. But
Yeah, wow, that's got to be tough as well.
so you see the 1.5-year-old running around doing things, and you kind of realize, well, the 6-year-old, I didn't really see a lot of those things. So now I get to see all of that, with my younger son, and be a part of that more. Not that I wasn't a part of it, but more. And I think that's something that probably isn't talked about in training, medical training, or college, or whatever field you're in, but probably should be, talked about.
I think it's so important too, because I think just when you think about what a surgeon or a doctor does, they're helping solve everybody else's problems, right? No matter what specialty they're in, someone's coming to them with a problem and they're having to find the solution. And then, like you said, so often they don't try to solve their own problems, or they can't because they don't have time because they're doing everybody else's problems. So then it's just a downward spiral. And then if you let it get too far, it can really catch up and either burn you out or, get you depressed. And I don't think that there's enough focus on that, like you said, in school talked about, where it's like the accolades are important. Yes. Like you want somebody that's qualified to work on your hip, to work on your knee, to do your brain surgery, whatever it might be. However, at the end of the day, you are never going to be replaced by your family when you go home. And so that also has to be just as important as your career. And it has to be intentional in how you spend that time, because it's so easy to get lost in just the hustle culture and if I, just work a little bit harder for the next few years, then I can take a break. And it's like, yeah, right. You know what I mean? Like then you get addicted to that kind of cortisol and that just high stress state. And it's really hard to get out of, like you said. I mean, you can try all you want, but if that's been your world, then you're used to it. And then when you're not doing that, you feel unproductive.
Yeah, no, it's totally true. And I think that's something I try to remind myself, and it sounds, I guess, a little negative in some ways, but is true when you get down to it, is that everyone's replaceable. Everyone's replaceable in their job, but you're not replaceable, to your family or your friends. And so, you do have to kind of just keep that in mind perspective. And I think everyone should strive to be the best in their job and the best, in their personal life. And, you want to strive to do, 100% all the time. But it's a hard pill to swallow. But I think once you understand that everyone is replaceable, then I think it's easier to accept.
Yeah. Well, and you're not promised tomorrow. So, you've got to live as if, like you said, reach out to your friends and be present and do those things intentionally, because at the end of life, no matter when that is, you don't want to feel like you just spent your entire days just working and taking care of everybody else.
Yeah, exactly. Very true.
Cool. Well, I've appreciated this. I think it shed some really, interesting light on just kind of what has happened in orthopedics and what people can anticipate if they're new and maybe they're going through medical school right now and thinking about becoming an orthopedic surgeon, or maybe they're that orthopedic surgeon who hasn't quite found the balance yet and they're looking for it. So whether that's you that's listening, definitely reach out to Eric. I'm sure he has a few pointers that he can share with you. But outside of that, I really appreciate you coming on and sharing all that stuff with us.
Yeah, thank you, Maddie. I appreciate you having me on. I'm grateful to share my experiences, and it's been a lot of fun.
Definitely. It's always good to talk to other, not native Rhode Islanders, I guess, but still Rhode Islanders.
I've been here long enough. I consider myself a Rhode Islander at this point. Just maybe don't have the accent.
The better question is, do you like Dells or Mr. Lemon?
I like Del. I do like Dells.
All right. That's the right answer. Awesome. Well, thank you so much for your time. Until next time.
Have a great day.
Thanks for listening to the Healthy Careers Podcast, where we provide a platform for you to ask hard questions and get real answers. If you enjoyed this episode, don't forget to subscribe and share it with your friends. Stay tuned for more episodes every other Friday at 7 a.m. Eastern.